In this video, I will teach you everything you need to know about the monkeypox virus, where it comes from, where the latest cases have been recorded, and how to avoid it. What is monkeypox, and what can you do to avoid it? Hi, I'm Dr. Manu, and this channel is all about health and wellness. I help you by providing certified scientific information in a simple and cohesive way. Now, let's dive right in. What is monkeypox, and where did it come from? Monkeypox is a rare, incurable disease caused by the monkeypox virus. Monkeypox is a viral zoonotic disease that mostly occurs in tropical rainforest areas of Central and West Africa and sometimes spreads to other regions. Monkeypox was first discovered in 1958 in monkeys, hence the name monkeypox, but the first human case of monkeypox was recorded in 1970 in the Democratic Republic of the Congo, and since that time it has continued to expand. The source of monkeypox is unknown so far. However, African rodents and non-human primates, like monkeys, may be able to transmit it to humans. The symptoms of monkeypox. Monkeypox begins with fever, headache, muscle aches, and exhaustion. One particular characteristic of monkeypox is that it causes lymph nodes to swell. The incubation period, which is the time from infection to symptoms, for monkeypox is usually 7 to 14 days but can range from 5 to 21 days. In some cases, you may also have symptoms of backache and chills. 1 to 3 days after fever starts, sometimes it takes more days, the patient develops a rash which often appears on the face before spreading to other parts of the body. Lesions progress through the following stages: macules, papules, vesicles, pustules, and scabs. The illness typically lasts for 2 to 4 weeks. In Africa, monkeypox has been shown to cause death in as many as 1 in 10 persons who contract the disease. Monkeypox. And what are the precautions? Monkeypox is transmitted to humans through close contact with an infected person or animal, or with material contaminated with the virus. This tropical disease is transferred from person to person, mainly through direct contact with sores, even tiny and imperceptible to the naked eye, body fluids, or respiratory droplets. To try to stay away from the virus, you should avoid contact with animals that may carry the virus, including those who are sick or have been found dead in infected areas. Keep away from bedding that has come in contact with any animal that may be diseased. Keep away from infected people, and do not share the same space and the same objects. It is essential to practice good hygiene after having contact with any infected humans, animals, or animal products. For example, washing your hands with soap and water or using an alcohol-based hand sanitizer is a good way to stop the spread of infection. Use personal protective equipment, PPE, when caring for infected or suspected of being infected people or animals. At these links that you find in the description below the video, you can find the list and the correct procedures for wearing personal protective equipment, PPE, treatment, and vaccine. As I said earlier, for now there are no specific treatments available for monkeypox infection, but monkeypox outbreaks can be controlled. Smallpox vaccine, Cidofovir, Cent 246, and Vaccinia immune globulin, VIG, can be used to control a monkeypox outbreak. Quoting from this government site for the prevention of infectious diseases, one vaccine, Geniospasm, also known as Imvamune or Imvanex, has been licensed in the United States to prevent monkeypox and smallpox. Because monkeypox virus is closely related to the virus that causes smallpox, smallpox vaccine can also protect people from getting monkeypox. Past data from Africa suggests that smallpox vaccine is at least 85% effective in preventing monkeypox. The effectiveness of Geniospasm against monkeypox was concluded from a clinical study on the immunogenicity of Genios and efficacy data from animal studies. Experts also believe that vaccination after a monkeypox exposure may help prevent the disease or make it less severe. From another section of the same site, we read, vaccination after exposure to monkeypox virus is still possible. However, the sooner an exposed person gets the vaccine, the better. CDC recommends that the vaccine be given within 4 days from the date of exposure in order to prevent the onset of the disease. If given between 4 and 14 days after the date of exposure, vaccination may reduce the symptoms of disease, but may not prevent the disease. Most people who get monkeypox vaccine have only minor reactions, like mild fever, tiredness, swollen glands, and redness, and itching at the place where the vaccine is given. However, it is estimated that between 1 and 2 people out of every 1 million people vaccinated will die as a result of life-threatening complications from the vaccine. At this time, the cases outside the tropical regions were recorded in United States, Canada, England, Israel, Portugal, Sweden, France, Spain, and Italy. Authorities recall the first serious monkeypox outbreak in the United States in 2003. In 2003, 47 confirmed cases of monkeypox were reported from 6 states: Illinois, Indiana, Kansas, Missouri, Ohio, and Wisconsin. All people infected with monkeypox in this outbreak became ill after having contact with pet prairie dogs. What caused the 2003 U.S. outbreak? Investigators determined that a shipment of animals from Ghana, imported to Texas in April 2003, introduced monkeypox virus into the United States. The shipment contained approximately 800 small mammals representing 9 different species, including 6 types of rodents. These rodents included rope squirrels, tree squirrels, African giant pouched rats, brush-tailed porcupines, dormice, and striped mice. The authorities are on alert, but we certainly cannot speak of a pandemic given the very small number of cases. Meanwhile, implementing precautionary measures and contributing to strengthening one's immune system is the best preventive defense. If you feel you are in close contact with monkeypox-affected people or animals, contact the health authorities immediately and follow their recommendations. If you like this video, don't forget to like, subscribe, and hit the notification bell to stay up to date on new content. Thanks for watching.